Hey, everybody. Hey, welcome. I want to welcome all of you. It's so great to have all of you tune us in and turn us on while we are getting warmed up here and tracking down our fabulous guest for today. Dr. John Huber is joining us here today, and they're tracking him down. But first, let me say hi to Benny. Hello, Benny.
Hi, Pat.
I'm trying to fix my mic setup here. It's
Uh-oh.
like I don't know, like how to get it the way I want.
We have to add another producer to the labor squad.
Yeah, I mean, I gotta like, how do I like? Okay, if I go like this with my mic, hang on. If I go like that,
You're becoming your own engineer now.
and then I do. Wow, this is not gonna work. This is so like.
Righty tighty, lefty loosey. Let's
Oh
start
my
there.
God! Wait a minute. Wait, hang on, everybody. Wait. Oh, you can't see me. Okay.
Oh, they can see you all right.
Facebook. If you're on Facebook, then
They
you
can see you all
me.
right.
Okay, but this little thing, watch this. It goes back and forth. Like, what's up with that?
Yeah, it's just a little too heavy.
This is not my studio. It's like my home arm. It's not like you've got there where they're like super sturdy.
Yeah, but things loosen up over time. I mean, but yeah.
Yeah. How do I sound?
You sound okay.
Benny. OMG.
Yep.
Okay, does everybody out there want to hear Dr. Pat's latest discovery with getting COVID-19 relief? Does everybody want to hear like a funny story or not?
I'm always down.
So I had to reach back out to Jonathan Bell because I think we got to get Jonathan back. So honestly, I have tried everything in my power, right? I have tried everything in my power to understand how this COVID-19 relief works. But I will say, whoever is in charge of the stimulus check did a good job putting that into my bank account today. So thank you for that. The other thing that happened is I filled out pretty much what I thought was every form that you can fill out, PPP. And most of the people said to me, go ahead and fill out the forms, Pat, because yeah, you know, if you have contract people, that's okay. 1099 people, we just want to keep the wheels here in the United States of America churning. And this could be one of those television shows like Saturday Night Live story. I have not only filled out these applications, I've helped my folks do them, I've helped my colleagues do them. I'm helping people fill these out. But OMG, I don't think that the folks that created these forms are getting it. So you fill it out, Benny, and it says if you're watching the CNN or you're watching whatever the TV deal is, right? This
is for your the PPP, the small loan, right?
The PPP is for in payroll.
Right. Okay.
That's for your payroll.
Right.
But they said 1099s and contract people. Remember the big word came out? Yeah, everything's available for gig people. How many shows have I done now with Gina Rivera, the whole thing talking about this? So why isn't it easy to get it? So I'm one of these folks that I missed the first go around with my bank who shall not be named during this show. I don't want them to call me. And I have now dialed or tried to dial to talk to a person about my application 692 times. And all the mailboxes are full. And I've emailed them and I have a special. So I don't know how the people that don't have access to the resources I do, I don't know how they're even doing it. I got to tell you, my heart goes out for all of you out there, all of you people that are sole proprietors, or maybe those of you out there that hire contract people or 1099 people, and you're trying to get help for them. I will say that I think we made really good breakthrough with helping my folks get unemployment, while I don't think that Some of them got employment, some of them didn't. And, because we're living in really uncertain times. So you want to help people just in case, cutting back hours. So I'm helping my friends and colleagues to do this. So yesterday, we're all trying to do a Zoom call. Thank you, Zoom, for being you. And we're working on, and I'm like, I've got to do a Facebook Live show on this. And I honestly want to do a Facebook Live show with bringing Jonathan Bell back, uh, bringing gentlemen I met from Merrill Lynch on. I'm trying to even get Nancy Pelosi, because what I want to say to all of y'all lawmakers that did this, I'm getting ready to call Patty Murray and Maria Cantwell, and I'm gonna say, dudes, sit down and try to fill out the applications. Sit down and try to Google this to figure out what people are looking for, because I love that they passed this new bill. But if you're like me and my poor accountants, I'm driving Bill crazy. But if you're like me, you have filled out the form 999 times and they keep coming back, even though you filled out the form and you said, da 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 da, contract people, 1099, blah, blah. Even though you said that, they still come back and ask you for payroll filing for people that you don't have. And about yesterday at 8 o'clock at night, I was talking to a couple of other radio hosts, of course, my colleagues, and we all agreed that we should do this full show, almost like a webinar, where we share our screens and we walk through the process and we just look at the journey for applying for any kind of COVID-19 relief on your own. And honestly, I don't know how the average sole proprietor, business person, entrepreneur, I don't know what you want, whatever you call yourself, if you all have figured out how to do the PPP forms, call me now, 1-800-930-2819. Because this has been, I'm so glad I can still laugh about this, Benny. This is like our goldfish story, right?
Mm-hmm.
You go through and you're feeding the machine and you're giving them forms. And every day after I upload more forms, I get an email from one of them or all of them saying, you haven't provided us with all the documents. And so you try to dial the phone and you're calling everybody and you're like, okay, so can you imagine me? I've got 3 phones right now. I got my cell phone, I got my Skype number, and I got my home phone. So here I am. I'm determined to get information. You got to help me fill this out. So I have all 3 phones going at one time, dialing. So I dial one place with my cell phone, click here to get to this, click here to get to this. Okay. Then you got, okay, we'll be with you in a moment, longer than wait time. So then I've got my Skype number and I'm dialing in my Skype number and you're clicking over there and you're trying to get help and you're on hold and you're waiting. Then you've got my landline, right? You got that thing going, you're dialing and you're like clicking into it. So I got like 3 different things that I'm trying to do, 3 different agencies, because I'm trying to talk to like a person. I'm talking to a person. And my poor accountant, Bill, what a great guy. For those of you, if y'all are looking for an accountant firm, a CPA firm, Bill Lochran and Associates out of Edmonds, right? To Bill. And this is like after my accountant is saying to me, oh my God, Pat, we're down to 2 people. Please be patient. And absolutely have been. But I emailed him yesterday and I said, Bill, I know I flunked accounting in school. I'm not an accountant, but my gosh, I should be able to fill out a form right. So guess what I get back from my accountant? Do you know what I got back from Bill?
No.
It literally brought tears to my eyes. 2 words: called me. Oh my God. Now I haven't called him. I'm going to call him today. So I don't quite understand. But if you're watching Nancy Pelosi and what is the other one? Chuck Schumer and everybody out there, I mean, I'm my next thing is I'm trying to call Governor Cuomo now because I'm
I'm sure he's a little
trying to
busy, but
find
you can
out
certainly
from these
try. Yeah.
people how in the world, which one of you would like to tell us, one, what we should apply for?
Mhm.
Two, did that advance we applied for, what happened to the rest of the money we asked for? And this could be like a Saturday night skit if it wasn't so dang serious, right? Like, wow. But I got to tell you, Bill Loughlin, thank you, Bill. Like when I got his email back and it said, simply call me. That right there, for all of you folks, the lawmakers, our state senators, all of the people out there, we just want to talk to a real person because I'm no different than many of my colleagues, Benny. We have totally missed out on the first wave because there's some document, and they don't really tell us which one, some document that we didn't give them.
Hmm.
I'm
Press-
thinking I need to go back and take a couple of accounting or some classes or something.
It's just an overwhelming surge of people wanting the same thing. And they're balancing all that, especially even with my kids' stuff at their school. They had a portal mess up yesterday trying to get online with all of the other classes. And so, all the meetings, the kids want to see other kids in their classrooms. It's just overwhelming at times. And you're trying to fix these issues as fast as they can. Right? Yeah.
Wow. Wow, it is. Hey, we're going to take a short break. When we come back, I hope we're gonna be talking to Dr. John here when we come back. I'm not 100% sure, but we'll see. Stay tuned, everybody. We are also taking your calls 1-800-930-2819. We'll be right back, everybody. Oh my gosh, we are Dr. John. I mean, we are here for those of you out there. I was just talking to you about my very special guest today. And one of the things that I shared with you is I was so thrilled, to have him joining us here today. For a lot of reasons. And for many of you, you just heard me rant about what it was that was going on with applying for funds. And I know it's not part of what we're going to talk about today, but it is part of a conversation that has to do with the status of our psychology in the world today and where we are. But think about this. What if you're out there and you're thinking, how do I protect my mental health? See, what you heard me talking about in the first segment when I was waiting for Dr. John Huber joining me here today, what you heard me talk about was me, they call me the queen of positivity, giving you an example of all of the different doors, labyrinths of applying for relief. And I'm just one person. So sometimes I think I'm alone. But what about our mental health? What about it? Are we even talking about it? Well, I think we're talking about it now. And why is that? Because the headlines yesterday talked about one of the doctors from the emergency, young woman, doctor, they believe committed suicide. So, are we talking about mainstream mental health from the perspective of the various tentacles that it has? But that's why my guest today, who has been committed to understanding mainstream mental health, and as a matter of fact, chairman for Mainstream Mental Health, it's a nonprofit organization, and it is to bring positive change, just like us. That's us. We're a network, positive change of individuals that suffer from mental health issues. Now, why am I familiar with this? I've shared this more times on this show than I can remember ever. My mother committed suicide when I was 6. My sister died on a hospital floor from mental illness. 2 other sisters also passed away from drug abuse and addiction. So, having issues of mental health, I'm familiar with it. I'm not familiar with what to do about it in today's world. Thank you, John. Thank you for joining me here today.
Thank you for having me, Dr. Pat.
I don't know. I don't even know where to start with this because yesterday the headlines hit and they talked about this one doctor, just one doctor, right? And there was they were alluding to post-traumatic stress disorder where, this might be a thing. But here we are. What is it that here we are? We don't even know what we don't know, do we, about mental
Absolutely.
health right now?
Absolutely. And this is such a unique situation, but definitely that post-traumatic stress disorder is, I'm seeing the symptoms and, we don't know what that's going to look like, even when everything gets lifted and we're back into our normal patterns. Somebody gets a cold at your office and your whole office might go into total, trauma and trauma reaction, trauma response. So we're out there, like you said, we don't know what we don't know about it at this point. And the best thing we can do is talk about it, keep it on the table, let people be aware that there are people who aren't going to criticize them, not going to put them down, make them feel like somehow they're inferior, because this is a human condition. It's not a broken condition.
John, Dr. Huger, I want to talk to you about something that happened to me at the grocery store, or what I observed at the grocery store. And it wasn't fighting over the eggs, right? The 1 dozen of eggs you can get. No. Here's what I observed. And this was the first time I saw this. You ready? We're in the grocery store. I've got my mask on.
Okay.
I wear black tattoo gloves, got it on, got the mask on. And there was a gentleman in the store with a young child, no mask, no gloves, nothing, not observing, 4 feet, 3 feet, no feet, nothing, 0. And I live in a very kind of easygoing place. This is not New York here. So for somebody to comment on this, you have to know that their fear level is past the brink. And I got to tell you, I thought we were going to have a riot in the grocery store, because watching this guy with this young child up and down the aisles, like he owned the store pretty much. This is what the other guy said. And then this other guy with his mom with the mask turned to this guy and just went at him with the young daughter. I'm not surprised we're not seeing more of that. Are you?
I think we're seeing it. I think people just aren't talking about it because people are embarrassed. They don't want to be the one that, oh man, I let my kid run rampant over there. I probably shouldn't have. And, they're not going to be going in on social media saying, hey, I let my kid go and scare all these people and they got mad at me and chewed me out. And what kind of people are they? Because they're going to look bad. So we're not hearing about it, but I think it is out there. I've seen it myself.
Well, and you're out in the world and you're talking about this. And I think you commented that you were just on a news show, but I want to ask you about this idea, social distancing, what are we calling it? Shelter in place. It has deep-seated, multifaceted effects on people. Everything from what we're talking about, pent-up anger, but it's certainly also, and the science is starting to show it, it could have effect on our physical aspects of who we are. What have you discovered? What have you found?
Well, I think exactly what's happening is we're having some physiological responses from it. The lack of human contact, it does so much to our neurotransmitters. And if you don't have a healthy mind, you can't maintain a healthy body. It just will not last. And, people are afraid, whereas before, if they would have had chest pains, they may go immediately to emergency room, you know, and I think they're take care of, and things like that. Oh, it must be just anxiety. I'll stay here. And they're making mistakes. And we are letting ourselves kind of go and sitting on the couch. And, one of the things I hear is, all the time we poke fun of it. When is my 600-pound life going to call me after this quarantine? Because people are being sedentary. And one of the things we try to do in my house, my wife and I, we try to go walk every day and get outside and breathe the air and get the sunlight. In fact, most of my radio interviews since the quarantine do out in my backyard sitting on a chair because I get the sunlight. And my dog comes up and sits next to me, and she enjoys the outdoor time with me alone. So, it's kind of, it's pleasing, and it's keeping my mind fresh, and it's better than me sitting in a dark room watching YouTube or television all day long.
I want to ask you this question for sure. Look, here you are, as I said, chair, Mainstream Mental Health, right? A
Yes.
great organization, foundation, donations, people to donate. I want to ask you this question from your perspective, sort of a micro of something bigger that's going on. What do you believe is going to be the multifaceted aspect of this idea of people not having a known date for what they could expect in their livelihood again, if ever?
Well, I think it scares a lot of people because most people, when you look at the numbers, most people pretty much live, one or two paychecks out. And, people are starting to get scared now. Am I going to get my car repoed? Am I going to get evicted? What's going on? And not having that number there. And then the problems you mentioned earlier on your show about the relief and the PPP and all that. I mean, those are very real, tangible issues, and it's not as a result of their own behavior. So a lot of people are feeling punished for, in some cases, just being healthy, and that's not a good thing. We don't want that. And a lot of people, it's causing depression and behaviors like that. What are we going to end up with? Are we going to end up with individuals who, when they do get to go back, they can't? They're stuck in their house. They get kind of a locked-in syndrome, and they don't want to get up and get out because the paranoia. They had to have that cognitive dissonance. I'm doing this because.
Yeah, I think we just may have lost Dr. John Benny. Why don't we take a short break?
Okay.
And Olivia, we'll be able to get him right back here in a hot second. Why don't we do that, everybody? When we come back, we're going to talk about this short term, long term, and today term. What is it that's happening? What have we discovered along the way? And the bigger question is going to be, when the light switch is turned on, will you be the same person you were when the light went out? Stay tuned, everyone. We'll be right back. Hey, everybody, welcome back. Welcome back. Dr. John, thank you so much for joining me here today. Before we hop on, what is the best way for people to find out about you, what you're doing, and also some of the things you're talking about are so important. I'm sure you're going to continue to get out there and talk about it, but how do they find out about you? Did we freeze up there?
I think we may have again there, Pat.
All right, so here's what I want to do. Olivia, why don't you see if we can get Dr. John back on just on the cell phone without the video. I'm going to tell you how you can find out more, and here's where you can go. Go to Mainstream, right? Got that? mainstreammentalhealth.org. You can go ahead and do that. Certainly, you can go to Twitter at Mainstream, right? You get this? Mental, MENTL. You can go there and find that. Dr. John, you're back. Thank you.
Yes.
Look,
The easiest
I want
way.
people to find out about you, the articles you've written. How do people do that?
Well, the best way to find out is to go to my website, which is mainstreammentalhealth.org, or you can also get there through drpsycho.org. That's drpsycho.org. And hook onto our social media. That is the most up-to-date stuff. Now, this is nonprofit. Everything we do is is voluntary, and we don't change our website as much as we probably should, but our social media has links to all of our stuff, the TV, the radio, shows like yours. Also, go to Spotify, go to anywhere you download podcasts, and we repost interviews, and then we have our own podcast, and we talk about current events as we go every week, actually. So check it out.
Yeah. Look, I am doing my best to talk about this. I am doing my best to bring people on like you to talk about it. I think talking about it is the first step. Is it an end all? Is it the way? No, it's not. But I
No.
also want to encourage people to call their lawmakers. You see, even if you have to dial a number, what did I say I'm up to? 692 times with my bank. The mailbox is full, right? And this has now been going on for 4 weeks. But we have to get the message out to these people that are showing up on these news channels saying, yeah, we got this money. It's not good if you have the money, and because you don't have an entire team of accountants, you don't know how to fill out the form, or you're filling out the form, but you miss this little nuance, right?
Yes,
That is stressful. Can you talk
absolutely.
about the multiple levels or layers that stress is piling on for people right now?
Well, you got a lot of different layers. We were talking briefly off the air about the lack of our sense of self-worth. And a lot of people, they don't identify. I'm not a mail carrier, for example, but a lot of people say, I'm a father.
Hey, Pat, want to jump
Hey,
in there?
Benny, let's go to a short break and let's see if we can
Yes,
bring Dr. John back just on a cell phone without the video. Let's do that, everybody. Let's take a short break. We'll be
okay.
right back. Welcome back, everybody. Welcome back. I want to just make sure that you want to find out more about what Dr. John's up to. Go to mainstreammentalhealth.org. Lots of information over there. Make sure you, as we said before, follow on social media and so forth. What is the best social media place for people to go there, John?
Probably the best one is to look us up on Facebook, and we do daily posts there. And other than that, anywhere there's podcasts, you can go to YouTube, you can go to Spotify is my favorite. But if you go to YouTube, you can also type in Dr. John Huber and TV, and you can see all my interviews and stuff like that as they get posted up.
During the break, we were talking about a number of different things. And actually, Olivia will probably want to use some of that conversation during a break and put it in, to the interview. But one of the things for sure is we're talking about the multifaceted aspect of this, right? How to protect your mental health during the coronavirus pandemic. I mentioned to you a small statistic, just small. Alcohol sales are up 422% and rising.
Yes.
That is never a good statistic that adds to an already stressful scenario.
Absolutely. And we have in Texas, we have a licensed chemical and dependency counselor licensure and stuff like that. And I have some people that I'm trying to supervise that are working towards that. And the conversations we've been having, actually this week, was how they're feeling so sad, because all these people that I'm working with, they are functioning alcoholics. They're not, they're recovering alcoholics. I'm sorry. And they're sitting there with their maintained sobriety, and then they talk to these individuals who are falling off the wagon, and they're like, man, I just want to sit down and cry for these people.
Yeah.
And because they've been there, they know exactly what they're going through. They're sitting there alone or isolated. They all they can think of is, they need that bottle, they need that alcohol to numb themselves. And it's
Yeah, I got to
sad.
tell you, one of the most breakthrough. I talked about this the other day because I was talking to a lot of people out there that are wondering where do we go. And here's the thing that I love about this. People say, "What are some of the good things that are happening from this, Pat? You're like queen of positivity." And the answer that I got the other day was, "Okay, here it is. For the first time since 1930 something, 12-step meetings are now online."
Yes,
Yeah. And
that
thank you,
that's
Zoom, for that, because
yes.
people are actually able to see each other. Um, but let's talk about some of the things you've been out there talking about. Social distancing, for example. This idea that, yeah, we're going to go, right? We're going to go back. We're going to open up the businesses. We're going to open up bowling alleys. We're going to open up, and everybody's going to maintain their masks and their social distancing. And then yesterday, headlines, news flash, vice president's at a medical place and he has no mask on. Do we really think that folks are going to abide by this?
Well, I work at medical hospitals, and the infectious disease doctors and myself, we have these long conversations about masks or no masks. And when we wear masks, it's because we're trying to protect our patients from something we might be carrying.
Yeah.
The masks will not, the way they're designed, those cloth masks will not keep you from getting COVID-19. But
Yeah.
if you have it, it will help keep you from spreading it. And we sit back and we get checked every time we walk into the hospital. We get checked when we walk out of the hospital. And the staff, we're pretty much on top of things. And we feel like, if we've been exposed to it, we've been locked down and shelter in place for almost 6 weeks here in Texas.
Yeah.
We've already gone through the cycle. So, there's this mentality that uh, you know maybe we have this false sense of protection if we wear these. And I think that's what the general population
Yeah.
has. So I'm not necessarily upset that the vice president didn't do it because, if you go back and look at the CDC, if you're not used to wearing a mask, it actually increases the likelihood you're going to get it if you're around people who have it because you're always adjusting the mask and touching your face.
Yeah.
And that's with or without gloves because people also don't understand the gloves. My wife and I talk about this every time we go out with people with gloves, and I see them touching doorknobs and
Oh,
and all these things, and then they touch their face like the gloves somehow protect them, even though it's just like their skin. You have to keep replacing the glove. You can't just wear one pair of gloves all day long. Every
no.
time you touch something, you either wash your gloves like you would your hands, which in that case, why are you wearing the gloves? Just take your sanitizer with you and use it all the time. Again, it creates this false sense of protection that isn't really there because people aren't using the tools right and appropriately. And that's where just telling people to do that, I think, is not benefiting. And when we talk to the researchers like at Harvard and Princeton, and they talk about the disease model, sheltering in place doesn't stop the disease, it slows it down. So instead of maybe the whole nation having a 4-month period of COVID-19 season, like flu season, it stretched out to 9, maybe 16 months because it just slows down the transmission of it. I mean, we have a family, friends of ours, that last week, after 5 weeks of isolation, the whole family came down with strep throat.
Yeah.
And they're in their house.
Yeah.
So disease is disease. I mean, it survives. That's the nature of it. And if we have that false sense of security, like somehow I'm going to be perfectly fine, and you have a weakened immune system, you're going to be in trouble.
Yeah. I'll tell you to be honest with you, what I'm looking at and really concerned about is the emotional and psychological impact of this.
Yes,
I mean, we're very clear of what the physical impact is. I mean, every day on the news, you'll get something about it. But I was hoping that with the suicide of the ER doctor that made the headlines yesterday, that there'd be more talking about it. And I'm not seeing it. And I wonder
we're
if
not.
it is because they don't know how to talk about it, or it's pretty much too scary now to talk about the psychological and emotional impact of this.
Well, and there may be other things involved with that suicide that we're unaware of.
Yeah.
Something outside of COVID-19, and
Yep.
that may be why it's not going anywhere. We have to talk about different things. For example, we've had some young people die here in Texas
Mhm.
about it, and they go, "Oh my gosh, it's killing even the young people." Well, when we start looking at immunocompromised people, and we find out that later, and I'm not mentioning any names or anything else, because there's actually, you can get felony charges for disclosing someone who's HIV positive even after they're dead.
Yeah.
So what people aren't realizing is that young people can be immune compromised also, and we're not talking about some of that because there are laws to protect that. So the media will go on, oh, and it killed this 30-year-old, and well, wait a minute, it's not just the COVID-19 there. That most fatalities, 99% of the COVID-19 fatalities, they're comorbid. There's other disease process in play, and people need to remember that. So you need to be healthy. Get
Yeah.
outside, walk, exercise in your backyard, go stretch on your patio. You know, try yoga. There's thousands of yoga instructions online, whether it's YouTube, Instagram, TikTok, Snapchat. They're out there, thousands of them. Try it. You'll be amazed at how much better you feel. It actually flushes your lymph system out, which is part and parcel to your immune system right there. I mean, your lymph system is very important to your immune system. Plus, the vitamin D is essential for your
Oh
immune
my
system
God.
to
Yeah.
fight viruses. Get some sunlight.
Yeah.
If you burn easy, put on sunscreen after you get outside, because it takes 20 to 30 minutes for it to fully absorb and be used by your body. So then you get 20 to 30 minutes of unfiltered sunlight that will produce your vitamin D and allow your body actually to utilize things like calcium that it normally just doesn't utilize because you don't have enough vitamin D.
I mean, we are in a place now where we have to talk more about the things you just talked about. This is not the show that where I'm going to talk with maybe a Dr. Kathy Obear about what we're seeing. We're both organizational consultants as well as this, and what we're seeing in a new level of isolation from people. Look, I play ping pong. That's my jam, right? Most of the people I hang around with, they are from Asia. They are
Yes,
from China. They are from Hong Kong. They are from Thailand. They are from Taiwan. They are from the Philippines. They are from these places.
yes.
Boy, when I talk to them now about the level of discrimination, and there's no other word for me to use about it, they are feeling above anything else, isolated from the virus. But there's a new level of isolation for these people. And I'm hoping Dr. Kathy Obear is going to talk more about that one.
Well, it needs to be, because I have friends in those same environments that come from those same backgrounds, and I'm seeing it too. And
Mm,
I reach out to them, and it's like they're almost afraid then, because I may be fine with it, but what if there's other people around me who aren't? And we heard right off the bat, when I was in New York City when they got their first identified case in March,
mhm.
and it was like less than a week, nobody was going to Chinese restaurants. A friend of
That's
mine
right.
out on Long Island called me up. He'd taken me to his favorite Chinese restaurant last summer when my family came out there with me, and he goes, "Oh my God, that restaurant has been there since I was in high school, and they closed their doors. They went out of business.
Yeah.
They weren't getting patrons." And
Yeah.
it's a sad thing, and it's a reality. It's that fear factor. We don't understand what's going on, so we hide and run from it. I mean, watch any scary movie. What works the best is the unknown, and that's what mainstream mental health is about, is to try and beat that unknown, get educated about it so you're not afraid of it.
Yeah, I have a true confession. I'm watching way too many of those scary things. I'm really observing my own psychological state, right? I mean, here two of us are in the field of psychology, right? Here we both are.
Yes.
And I had to catch myself the other day. You're going to laugh about this, but it's kind of funny and kind of not. is I love the movie A Quiet Place. Now, a
Oh,
million people have seen that movie, right? I mean,
yeah,
they're going to come out with Quiet Place too. I can't wait. But I find myself watching it like 3 times a week.
really? Wow.
I mean, now you talk about transference, right? I mean, the
Yes.
field we're in. So I found myself watching it. Now, why? Of course, I love that movie. But here's what my other side too many there's a joke about too many psychologists in a room, but here's my other psychologist friend saying to me, "Do you know why you're watching it, Pat?" And I said, "I really like the movie. I like Emily Blunt. I like the whole thing. I like
Uh-huh.
sci-fi movies." She said, "Did you ever think maybe there's an association that you have with the characters of this movie that are so isolated and they cannot speak?" And I just thought, that's really deep. That's pretty deep. But I started to really think about it, doctor, and I thought my friend is brilliant
No
about
number
that.
available. Press Uconnect phone button. Do you want
Yeah,
no
absolutely.
number available?
Absolutely. I think that that is a reality.
Mom, Sam.
My kids, I'm sorry. So,
That's okay.
um,
Everybody wants to get into the conversation. Look, I know you've got to run. I would love to have you back because we're going to start to do weekly updates on this, on the different aspects of this. We're going
okay,
to
and
actually organize it that way. I want to
that
ask
would
you
be great.
again,
Yeah.
please tell people how to find you, and then what's your personal message? What would you like to leave us with today?
Oh, excellent. What the easiest way to get me again is go to my website. At the bottom of the first page is all my social media, from the YouTube channels to Facebook and everything else. So it's drpsycho.org, drpsycho.org, and it's mainstream mental health. You can also get us at mainstreammentalhealth.org. And if I can leave you with anything, is realize that all this stress, all the anxiety, the depression, the emotional mood swings, all that kind of stuff doesn't mean you're broken. It means you're normal and you're a human being, and it's a human thing, not a crazy thing.
Wow. I want to thank you so much, and I hope you will come back because we have to keep really sharing some of the information we're finding and how to help people on a regular basis. So thank you so much for all that you're doing.
Thank you, Dr. Pat. I enjoy it. I love your show. I love what you're doing. Don't stop.
I'm telling you, no, I'm not going to stop. That's got to be like some song from the 80s, I think, though, right there. So thank you so
We're
thank
dating
you so
ourselves.
much. We're actually doing a humorous side of this because I'll tell you, I'm stepping in some potholes. It is hilarious about what I don't know about what I don't know. Thank
Well,
you,
laughter
everybody.
is amazing.
I'm
If
telling
you
you,
can laugh, do it.
we got to have a little sense of humor. We've got to. Let's take a short break, everybody. We'll be right back.